if there's any physios listening to this, like, there's no shame. You're all going to get a complaint. You're all going to get someone moan about you. It is normal. Like, just if it happens, chill out. If you've got a decent manager and someone in leadership that is half decent, the first thing that they'll do is probably have your back, support you, get your perspective, and give you scope to develop and learn from it. So if you are somewhere where they're actually on your back before even listening to you, then leave. And just, that's normal, isn't it? Well, don't leave. Don't just like leave. If you've got a mortgage, maybe just wait and then find another job.
That's financial advice.
All these people messaging me going, Memhet, thanks for the like. Great. I feel well supported. I now live in a shoebox. I'm under a bridge.
Well done. You have finally discovered the most important health podcast you will ever need as a medical professional. The conversations you are about to hear are guaranteed to change your clinical practice and hopefully transform you into a better conversationalist. They could even make you better crack at parties. Welcome to TCUP, where swearing is guaranteed.
Big Memhet, how's the crack?
Good, mate. Good. Crack's not too bad. Thanks for having me on.
So enthusiastic. By this stage now, great. It's lovely to be here. Thanks a million. Yeah, great. Yeah, come on, ask me questions.
Yeah, I like chop. I don't have a 4 of these.
All right, yeah. Well, I'll tell you what. Since you said it like that, right, I'm going to ask you 10 quickfire questions straight. All right, so it's either one or the other, okay?
Yeah. Go.
Night in versus night out.
Oh, now, night in. Hold.
Oh, VIP or up the front?
Oh, no, up the front.
Good man. Vinyl or digital?
Oh, I'm not as old as you, mate. Digital.
Dysplasia or FAI?
FAI.
Oh, bang on about dysplasia all the time, pal. Dysplasia. Oh, ask questions about dysplasia. Don't forget about dysplasia.
There. You're like, oh yeah, front row, back row. Oh, dysplasia. I thought this was meant to be a better podcast than the others. You just like getting me to go through all the important stuff. Let's crack on. Go on.
Teaching or treating?
Teaching.
Oh, I bet you are. Coach or therapist?
Coach or therapist? Oh, no, coach.
Swearing or no swearing?
Oh, no, I think swearing's really frowned upon. No swearing. No, I'm joking, swearing.
Messi or Maradona?
Oh, Messi or Maradona?
I love the way the music came on.
I know, right. Well, you said this is meant to be casual. I forgot to put it on Do Not Disturb, so vinyl.
England or Cyprus?
I mean, what question is that?
It's just a question.
Cyprus.
Sure. And then the last one is Cormac or Meekins?
Oh, I hate both of them. Neither.
That was the actual third option. Correct answer. Nice one. Right, and then another way of kind of maybe people knowing how, they probably don't know who you are because no one does. But if you were to kind of describe you as a person or therapist or educator through the medium of music, what kind of music, type of music, or anything with music reference would you describe yourself?
I don't know. I think if I'm going to describe myself as music, slow, melodic, multiple beats going. No, to be honest, I think those kind of things I struggle to answer about myself. Like I've got my music taste is fairly diverse and probably different to what it's like. With funny enough, have a similar taste in music, but I think my music taste is certainly far removed from probably how I would describe and like see myself as a clinician. I like to see, nowadays I like to see myself as a clinician as like thoughtful, provocative, like in a good way, like sensible. My taste in music is fairly opposing to that. It's not that calm, as you know. So yeah, I struggle to kind of like describe myself in that sense. when it comes to a music or an artist or something like that. But that's one of the things we found in common, though, right? You're hence why your questions were very led down the route of musical interest.
But to be it's interesting. Like, look, the podcast is trying to look into the nuances of communication. And as I was talking to Ben last week, Ben Cormack, talking about why it's not popular or why it's difficult, is just because it's even just what you just said there about music, and it's quite difficult and to be tangible about it. It's really difficult to measure. Plus, also, what's interesting about that answer, even though you didn't say what music, it was still, you gave me loads of information about you as the type of people, what you're into, and then you as a therapist, what you would see yourself. And there's like a bit of, I suppose, that flows into a question about like how have you developed the way because you teach in a certain way, and if anyone hasn't heard you teach, it's entertaining, keeps you alive. It's hopefully a similar approach I try to apply as well. How have you developed that? Why have you developed that? Why do you think it works? Tell me a little bit about why you have that style.
I think I don't know. I think a lot of it comes down to just like, I do think, look, this is probably going to be, I don't know, it may or may not be controversial. I don't know. Let me just be honest. And then if it's controversial, it's controversial. I just think certain things people have as part of their personality and others don't. I think also there is only so much stuff that you can learn. Like, I'm not a fan of, I'll be honest with you, and I kind of know loads of people are, this is probably what's going to be like controversial, but you're not going to see me reading a book about like, learn how to be more assertive or learn, like self-help stuff. I just feel like is too much it's too try hard. I think certain things, especially when it comes to like teaching, the way you teach, communication style, like you just said there, I think a lot of it comes down to just being fairly sensible about it and being a bit like using your common sense. Ultimately, if I'm going to go and learn from someone, I don't want to learn from someone who's going to bore me, right? I don't want to sit there. I've been there, the amount of like studying and stuff that we've done to get to where we're at, the amount of courses that you've been on, sitting there listening to someone talk, monotone voice, slide after slide. 20 minutes in, you're thinking, when's lunch? When's kickoff? Can I get a stream on my phone on the slide when no one's going to notice? You just get bored of this stuff. And I just think like that was the thing when I started to do the teaching. I thought I really want to kind of be engaging, but then it's just, that's what I mean about like kind of personality, that my personality is no different. I don't go up and teach and be like, I'm going to put on some sort of like facade and like try hard. I'm not, like, I'm just, to me, it's the same way as one of my mates came on my course recently. And he was just like, it's like just talking to you 20 years ago, like, or whatever, when we're at uni, it's just the same. And I was just like, well, I don't know any other different. I don't know any other way. That's just who I am. I would struggle. Don't get me wrong. There are certain scenarios where probably my teaching has to be a little bit more professional than probably what I do on my own courses. If I'm in a seminar full of room of like people that probably don't know me as well, I'm not going to necessarily be as, what's the word? Like not casual, but like, there's a word for it, like colloquial, probably, as I would do on my own course. But there'll still be some of it just because it's just who we are. And I think that's why people struggle with the teaching. Like, teaching ain't easy. Like, and I can look, I'm not a teacher. Fuck's sake, I'm like a physio that does a course. It couldn't be less of a teacher. I literally focus on one joint. But, it's still, you're teaching two people. And I think a lot of that value that people find is just them listening in a good way, and that's why I think this communication stuff, I guess, is like not that sexy. No one really goes on courses about communication and stuff, but it is the thing that makes everything tick properly. Like, if you're with a patient, if your communication is shit, like, you probably aren't going to do as well. If you teach and you don't communicate well, you're probably not going to do as well. Like, it's just life, right? If you go into bloody anywhere, if you go into retail or food or whatever, like, if you don't communicate well, it just goes to shit. Like, so I just think all that stuff for me stems from like the kind of person that you are, and why you'll probably find like people who you find entertaining to learn from have similar personality traits. There's not, I don't think it's coincidental that you and I get on. I don't think it's coincidental and learn from, right? I don't think it's coincidental that me and Adam get on and I learn from, and me and Ben, like, we're like, there are similar, and that's not, I'm just, there's more to the physio, just for old blokes. Like there's more, but
Yeah, I get you.
With Joe or Andrew, like everyone's got like their own niche personality traits that allow you to really, like, I guess, like understand and learn from, but like wouldn't necessarily have to be so formal. And I think all that stuff comes from the person. And I think that personally, I think it is hard to learn, but it comes with experience. Though, like, I don't get me wrong, and this is really an important. This has turned into a bloody TED Talk, not podcast, but I think the important thing is like you don't. When you become a physio, you still have like the nerves, the lack of knowledge and stuff like. You can't just like if you're a great speaker, you can't just on your first month of working go and do a course. Don't get me wrong, you need like the knowledge, but like your experiences and your personality that mold all that stuff. I think, from my perspective, anyway. So I don't even know what your question was, mate. To be honest.
No, you know what, man? I've just been trying to listen, because again, you've come up with some really kind of. It's so difficult, isn't it, when you start to break it down? Like there's other reasons. Like Ben said the same thing. He didn't want to come on and be like, "Oh, this is how you should communicate and be Lord of the fucking manor, and this is how telling people what to do." It's a really tricky. This is why I started the pod. This is why I want to do it, so people can see how difficult it is. And you mentioned a bunch of things in there, like your personality type, boring. Professional. No, boring as in like you were in lectures, and I was exactly the same, because when I was listening to lectures, I'd be like, this is just. I'm looking around, going, is anyone else just finding this really, really the same dull bore? The information is there, and yes, oh wow, that is an interesting statistic about a certain problem, but it's delivered in a way that you're sitting for 2 days, and I'm like, I've switched off after the first morning. Like it's so difficult to keep. I would say, and I'd love to hear what you think about this. We're an element. There's an entertainment about what we need to do. I would say, that you have to kind of nearly enjoy the enjoyment of interacting with people and having a laugh and try and bring out your own personality. And yeah, everyone's not going to get it, but I can still have a laugh with all different age groups. I can still try and work out their personalities during the course. I don't know if you do that, but it's like where you see somebody who's maybe just reacting differently to the language or to how I say it, and then just try and engage in them in a different way, maybe during a practical or something like that. And I would, say you're just adapting your communication, like the swearing and the joking might suit 20% of the audience, but then the other 20% where I hopefully have a balance of kind of like serious stuff, where I'm not just joking around. I might talk about empathy or grief and stuff like that. I'm not going to, you have to talk about it in a serious way, but then you have to also try and make it lighthearted, I think. And that's where you said, which would just be, was the word professional. And I think that's something I'd like to hear your opinion on as well. Or, it's funny, you were saying, oh, sometimes I have to keep it, and you use the word professional. I know what you mean, but it's like, what's the definition of professional in our field? Like, we're educating other people. What's professional mean? Do you know what I mean?
I know, but I think like what I meant by that point, is if I'm doing, I'll just kind of touch on two things. I'll touch on that comment, but also the other thing that you said there in regards to getting to know people. That's definitely something that I've developed, in the sense that, like, when you start off, you're right, you want to be like, and that's again comes down to personality. You want people to like you. You want people to like enjoy the course. You want them to like feedback. Oh, like Andrew was good crack. It was a good laugh. It was really relaxed. That's often, what I would see as a win. When we're doing the course, if someone's feedback was like, oh, it was really approachable, really like easy to understand, really got on with, had a good time, was relaxing, engaging. Like, that's a win. But to do that, also, the longer I do this, the more I realise you have to get the fact that, like, you're not going to have 30 of the same people in the room. You're going to have like 3 or 4 of them that are like, actually, don't talk to me. Like, I'm having a great time. I love it. Don't get me wrong. This is great. But also, I'm an introvert. Don't put pressure on me. Don't put me like on the spot. And those are the ones, when you're teaching, you're standing there thinking, they fucking hate me. Like, they're having the worst time. Like, why are they smiling? Why? Like, and you almost like try harder to get them ones. And then it's like, halfway into day 2, they're like, oh, thanks. You get them in like a little cluster, and you talk, and they're like, oh, I'm having a really good time, thanks. And, sorry, I'm a little bit quiet. And then you think, okay, cool. And the more I do it, the more I realise is that that's just life. People have that. In regards to the professionalism thing, is like, what I mean by that is, if I'm doing like a half an hour talk at a conference, and then there's like surgeons that I work with that are there as well, and the group are just like not just physios and like different providers and stuff like that. Unfortunately, the long and the short of it is, that level of professionalism is still fairly old school in what that would be judged by, in the sense that not swearing, being a bit smart, being a bit more like articulate with what I'm saying, being less like casual. Like that's unfortunately, well, not necessarily unfortunately, because I think there's a role for that. Also, I get that. I get that. Like, we are physios at the end of the day. We're not like cardiac surgeons. If I had to go and have, I don't know, heart surgery, and I went into the room and the guy's like effing and blinding and too over the top casual, I'd be like, in some scenarios you think like, oh, I do want someone that's a little bit more probably like old school. Do you see what I mean? But that will vary.
Yeah.
Some people might be like, well, I don't care if someone is like that, if I need the treatment, whatever. We are, at the end of the day, physios. We've got a little bit of like scope to just chill out and realise that we're not at NASA. We can be a bit casual. It's not,
I think that's the thing, isn't it? We're talking about, like, if you're that's a really good point about like the cardiac surgeon. It's the how people look at the complexity of the task that you perform as your profession. So, like you mentioned two things: cardiac surgery. Usually, it's brain surgeon or cardiac surgery, and an astronaut. They're the peak levels of. There's quite a lot relying on these people in the task they do. It's usually life or death such scenarios. So, that's considered high up on people's respect. And therefore, there's that, as you said, old school kind of treating of these people that they could not possibly speak in any other way than completely this way, like very clean, very respectful, etc. Old school values, which again, I don't want to knock them. But it's interesting then, we have this thing of, well, we're physios, we can be a bit more relaxed. But we have a really super complex job. You see, people end up on cardiac surgeon tables because they don't change potentially their lifestyle. And not everyone, but certainly it could be lifestyle factors, behavioral factors. And those people are coming into our clinic sometimes with, say, arthritis flare-ups. And we have a chance there to be able to have conversations to change their behaviors and habits that hopefully doesn't let them end up on tables like that, or having to have conversations with these kind of surgeons.
I get that. But I think that's
it's just before you. Yeah, that's what I mean. So our skill is, because you don't want to be like that. How many times do patients come into you? They don't want that level of kind of nearly, super strict kind of. It needs to be casual at that level, but that takes a bit of. But we're not trained like that. We're still. I would argue that we're trained still like a, that high level cardiac surgeon level. Really professional. But people can't. When you're talking about life or death, yes. But when you're talking about maybe just, how difficult it is to give up certain types of foods or get an exercise behavior change, like that does require a different type of approach. And that's my argument is that's also very, very difficult, and it's undervalued because we can't. It's kind of like, well, they're not going to die if they don't do it, but they might die in 20 years' time on a cardiac table. Do you see the kind of? It's a funny one. I really like the fact that you kind of said that, because that's kind of brought it down to type of conversations, and then just hopefully therapists, whatever therapist you are, that there is a time and a place to have that serious conversation, but a big majority of that needs to be done in a way that will probably be just like you said, just the way you are, your personality, and you can hone it down a little bit, but you have to kind of be yourself, really, don't you? Whether you're teaching or whether you're seeing a patient. What do you think about that?
I do. No, I agree. I think like you're completely right. I think the thing with that though is also, when it comes to those different scenarios where like it is in some cases a little bit more critical, there are those patients who are a little bit more not at risk, but like the situation is maybe more fragile for various reasons. The physios who are, for my...
Could you give me an example? Could you give me an example on that?
Like on one hand, you can have someone who has just like sprained their ankle a week ago or 2 weeks ago, who is like otherwise has no physical or emotional baggage at all, just like pretty boring. And then you've got someone who's maybe had like hip pain for 10 years, who's had surgery twice, who's like depressed and anxious and stressed and catastrophizes and off, like loads of other kind of physical, emotional, social type baggage that comes with it. When you're, from my perspective, like what I really try and get across with whatever I'm doing, whether it's online, whether it's teaching, whether it's whatever, is you do the people who do best have their communication methods, like we've discussed, but it isn't the same. If that makes sense. So like you have your way of communicating, but you have to like just be that like communication chameleon for whoever that situation and that context is in front of you. So you don't necessarily change how you communicate necessarily, but like, well, I guess I'm contradicting myself. You do, but like the way that you approach it is probably slightly different, but the way you communicate would be similar in the sense that you would still show the same level of empathy, same level of understanding, same listening skills, but your like communication isn't just like us sitting there talking to them and listening. It's all the other shit. It's like your body language, how far away you're sitting from them, the fact that you're even listening to them, you're not doing your notes, you're sitting there. Actually, some of them might need a little bit of like, let me show you on the computer what I'm talking about. It's all those other things that people will overlook. And the clinicians for me who are like top drawer are the ones who are so skilled at being able to do that without having to overthink it. But when you've got that person who is maybe 1 week ankle sprain, who probably has, little bit more relaxed or loads more relaxed, possibly has similar interests to you, probably similar age, similar area. Like on that hand, you still want to offer the same level of care. Your communication quality isn't going to be less, but it will be different to the other person who might be 3 decades older, and you've got loads of other elements that are causing that situation to be more fragile. You're still going to communicate well, but you're going to have to adapt. You can't do it. You can't do the same. But like for someone to be able to do that at 9 o'clock and at 10 o'clock, there isn't a course that like, I don't think there is a course that can teach you. I think that just comes with mileage and also your ability to understand all the nuance between that. And whenever I talk to, and don't get me wrong, maybe there is a course, maybe someone can prove me wrong. I don't know everything. But the other thing as well is like, if you have a physio or a healthcare practitioner trying too hard to fit into the box of like, what is good communication, and you are like thinking, okay, that one I've got to like listen more and do this, do that. Like you lose we're just human. You just got to like talk to people, just be like genuine. Like if you have like if everything you do is underpinned with just being genuine, it's so much easier. Because if you genuinely give a shit, then you probably are going to listen more. Like you are going to ask questions that are relevant, not like, oh, so when was your surgery? Have you had any drugs? What's your medical history? When was the last time you went to the doctor? Like that's just like AI. That's not a robot. Anyone could do that. It's like ask a question, listen to the answer, and if it doesn't direct you the way you want to go, so ask it another time, ask it later.
Well, can I? Yeah, it's interesting. Like this, it's hard, isn't it? When you start talking about it, it gets. You see what I mean? You kind of, you said, oh, contradict myself, but I'm not contradicting myself. And you can see in your head that it's very easy. It's even difficult to be tangible about how you do something as innate as talking to somebody. As Ben says, you do it all the time. You know what I mean? And you're not going to think you're a crap one, especially as a therapist. But what you said there, which is quite interesting, because Andy Hosgood, one of my first podcasts, said, his thing when he's employing his staff is that everyone gives a shit. He says the only thing you can't put on the wall, but that's what he'd like to put on the wall, is like, just give a shit about it. And I think that's interesting. You just eventually came to that point was, I'm not sure if there's a course, I'm not sure what to do here. It needs to be authentic, but just give a shit about somebody. So in some ways, that's a nice little, it's a nice way of saying it. It's like, yes, be interested. And I think it also links into what Ben Cormack said to me as well, which was, it says, just be interested in this topic though. He also said, like, I've done courses and I think I've learned from them. Like anything, I've taken stuff from it and that has helped. It's not completely I think there's flaws with them. They're a little bit too like, oh, you said that wrong, you said this wrong, and it can make you a little bit, like what you were saying as well. I agree with that. But then there's other like structures around it that really help me, and that just comes into the fabric of being a better communicator. But again, like, I'm just looking for, over hopefully these conversations, that we pick up things like that. It's like, when you go in, do you actually give a shit right there and then? And are you interested in this person and you as a person, as a therapist, in getting better at this job? Because I don't know if some people, do they actually sit there and kind of go, what happened there when it comes to maybe, say, a relationship you were trying to build with a patient? What went wrong? There's no problem with reflecting on that. But again, it still comes from what you said, just that authentic personal interest in somebody. So I think that was I think that's really good. Now, yeah, of course.
Let me just add, because I think there's just to kind of add a point just for others. I'm mindful that like people listening might be of like varying levels as well. Let me tell you kind of where I fall short with this stuff, because I think there's also bits that I can do better that I've realised probably more recently as well, because there's a limit to that, right? There's a limit to what we can offer. And sometimes when you give a shit probably too much, what happens is, one of my biggest weaknesses is not necessarily clearly all the time setting expectations and boundaries of what I can offer based on, I guess, how much I want to help that person. So as an example, right, if I'm doing online consultations, I'm fairly open, and historically would have said, if you've got any issues, if you've got any questions, blah, 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 you can send me a message or drop me an email, etc. On surface level, that seems like pretty normal information, right? If someone said that to me, I'd think, all right, cool. If anything crops up, I'll drop them an email. However, like, there are certain scenarios as well where if you're dealing with someone or a personality or an individual who has higher needs than someone else, that can be quite challenging, because I'll give that advice and guidance of like, drop me a message, email, whatever, because I give a shit, because I'm like, actually, like, I don't want you to do your rehab wrong. I don't want you to feel that you're unsupported. You've gone to 3 other physios as well. Like, I really want this one to work. So you're more invested in it. But then what's happened to me in the past is where that patient, then the boundaries of what I can actually physically offer is impaired, because all of a sudden you don't reply to an email within 2 days. Then your like relationship alliance or whatever is starting to be tarnished, because their expectations from the patient is, well, you asked me to email, I've emailed, you've not replied. Well, it's been 2 days. Like, no, you don't go to your dentist and say, can you message me on WhatsApp immediately? Like, there's a barrier. But also the difficulty with that is when I still want to offer that, but you can't, when you're talking about rapport. For me, rapport is like, nothing comes close to that. I think that is like the most vital thing in an appointment, is that initial rapport. If you're putting so much emphasis and focus on building that relationship trust through that rapport and all the skills that you go through that, I tell you what's really hard to not tarnish that is when you're going, oh yeah, you can drop me an email, but don't expect me to reply that quick. Don't email me that much. Like, because then you're like, well, actually, are you just telling me because you think I want to hear that, or actually do you want to support it? Do you see what I mean? So like, there's a limit there. So of like, you care too much and you offer too much, and sometimes you can't deliver on that. And I've had that even recently as well, where patient has been like frustrated with my inability to offer support between consultations, that then impacts that rapport. And because I put so much focus on that, as soon as I see like a little bit of that maybe diminishing, I'm like, I feel like I failed. Like, I instantly, because that is like, because I put so much on that trust. The second I'm like being questioned on something that's not necessarily clinical, but it's because of that, I instantly like, if I'm just like, it's almost like I just don't want to carry on, because I'm like, it's because so much of what I do is based around that. When that's not there, I'm like, oh. And
can I ask you then? Could I ask you then around that, if that's okay? Because that's brilliant. That's exactly. It's interesting because there's some like the evidence around perceived social support around injury is massively important for adherence, motivation. So there's loads of research on that. So that what you're offering is what I tend to offer as well. It is very valuable to patients. It's actually it's what often they're not offered. So it's a really important thing. But it's interesting now. What have you done to potentially still offer that, but what are you doing now when you say that to patients? Are you still doing the same thing and you haven't worked it out, or are you offering are you saying something different now, or are
No,
you saying like
I am. I think I am wording it differently, and this has been kind of like probably even more recently, where things have got where I am busier and I do have probably less. My main commodity is my time. And that's what I've come to probably realise. So now I'm just a little bit more clear by not probably going into it too much, and I'm just being a little bit more specific from the rehab perspective, in the sense that, like, if any of these exercises are causing an issue, let me know, and I'll see what I can do. Rather than before, it was like, if you've got any questions, if you've got any problems, blah blah blah. Like, if you want that, like, I'm here. That's what a consultation is for. So I had to kind of tailor it, and I think that's important for bearing in mind I've been a physio for 15 years. I'm still like, I think it's really important for a physio to know where their weaknesses are and where their shortfalls are. And for me, that was kind of one that I've had probably in the last 6 months when things got being a bit busier, where I'm like, actually, what? I need to kind of set like some clear boundaries. Because before, I would have, there were some patients I'd give my WhatsApp to and message and stuff just to kind of help. But for actually, I can't, there's only so much that you can do. There's only so much like brain capacity that you can use to kind of manage that.
Yeah, it's interesting. Like what's becoming more popular, and I think it's going to be the future to some degree. They do it big time in America. Frank Benedetto is a therapist over in America who runs a thing called the Honey Badger Project, and he's kind of bringing an approach like it's done in personal training, which is done again very well, online coaching, and like a hybrid model of not only do you see people. I see people for physical assessments, of course, but then having kind of what we've just been talking about, like check-ins or appointments where people, 15-minute phone calls, but building it into a package that you sign up for, basically. So in therapy, you would sign up for an appointment with potential follow-up phone calls just to check that, some patients may like that idea of that it's there. They'll have that phone call every week. If some patients don't want that. Some patients may want that, but it seems to be going good guns in America. I think if you set up well, over here it's slightly different because of we're not such an insurance-based medical care center, so that's where it's probably going to come across slightly different. But in the personal training world, that's a lot what they do, and I kind of suppose you're talking about your time, and that's one of the things that we're not good at. If you're brought up in the NHS, and then you go into private practice, it's quite odd, isn't it? Because you have to charge people, and there's all that kind of complexities over sales and money for health. Some people just aren't very good at it. It's not usually our best skills. Some people are better at it than others, but it's something that I struggle with to start with, of like charging people money. I always felt guilty, which is bizarre, because I'd spent before going into private practice 10 years of not having to do that. And there's pros and cons to that as well, because you're trying to give value for money as well. So I think that's just it's really more of a comment on it, not rather than a question, that these kind of things would probably help patients, but also help the therapist not burn out, or like you're saying, or just kind of like, because what you're offering, that kind of support that's worth it, because you're offering advice and good knowledge around your area, and people got to realize that if you call out a plumber and he gives you advice about your boiler or something that saves you money or stops it blowing up, like, that's worth that money. You'd pay the call out charge for him or her to go, yes, that's what you need to do. And no one kind of would just, argue with that. But people, I think when it comes to healthcare advice, it's kind of, you wouldn't mind just having a look, or just tell me a few things. That it's the classic physio problem when you go out on the lash with somebody and they turn around and go, my shoulder's painful. Like, I've definitely created better boundaries on that, which is basically to fuck off. I'm having a good time.
Yeah, I know what you mean, mate. I know what you mean. It's hard though, isn't it, when you want to help, but like, it is challenging. I'm probably too open for my own good, but I had a patient not long ago, hopefully it doesn't matter, who had only met once online, and had emailed and asked for to catch up because they hadn't got better. Their situation hadn't got any better with the rehab exercises that I'd given them. And I think one of them had like irritated it. I was like, it happens. It's fine. Then I think it'd been like a month. They wanted a follow up, but they didn't want to pay for it. They wanted a follow up because they didn't want to pay for it because they hadn't got any better. I was like, I don't think that's going to work. So we didn't have anything. And this is what I mean. Like the second, because that for me, I was like, that conversation didn't end when like there was like that when that came in. I was like, that's what I meant. Like immediately, the second that relationship is tarnished, I was like, this isn't going to work. My reply went down like a sack of shite, and then obviously at that point, that was it. That was wish them well.
That's great. That's really useful, man. Like, because that's the nuts and bolts of what I'm trying to get at. It's like, it's funny, isn't it? What people, like, the pressures you put on yourself as a therapist, but then you have this kind of nerdy, obligation to kind of be like, oh yeah, you didn't get me better, so therefore it's free. And it's kind of like, that doesn't work for any other industry, that kind of thing. You know what I mean? Like, unless you got like a fly in your soup, and you know what I mean, they'll bring you some more soup. It's not usually a big drama, but this is talking about someone's time, and it is interesting what people do, and it's identifying those kind of patients as well. I had a similar kind of, well, it was actually after hearing a psychiatrist talk about you can't help everybody, which is kind of, it sounds obvious, but I don't know. For me, like, I always start, and I'm sure you're the same, is when you see a patient, you're always thinking you can help. I'm confident I'm going to hopefully help them in some way. There's something I'm going to be able to offer them. I very rarely go in and go, oh God, I have no idea here, or there's no, even if I'm signposting them or something, I'm pretty confident that the experience they'll have would show some sort of positivity. And he stood up in front, and he was just he was talking about all the different types of psychological illness, and just being aware of different patient types. I'm not going to go into the details of that, but there was a certain type of patient, and he kind of went through. He went, so this is a person that you need to identify, because they're going to loop this, and you are going to end up being the person who's the problem. They will blame you for this. And I was like, oh wow. And about 10 patients flew into my mind that I'd had where they were like 15, at the beginning, and he described it. He described the relationship, how it would build, and I was like, oh my God. And it would be that you would come in after they'd seen lots of people, you will do something, and they'll be really excited and really happy that you're helping them. But then what they'll do is they'll continue to something will change every time, over time. So something will be, it's another little thing. And just as so they'll get a bit better, and they'll be really excited. And as you're thinking of an exit strategy for them, something will change. Or if you even mention anything about an exit strategy, the pain is bad again. So that, and then it would loop and loop and loop until you were like, I'm tied up in knots here. I don't know where I'm going. And then you would have to say, look, I can't help you anymore because we're not getting anywhere here. And then it would turn into quite a nasty communication, where the person then, in one case, wrote a 4A4 letter about how I let her down. And it was, I was like, oh my God, this is, inside I was going, I absolutely broke my back to help you. Yeah. And I did more than I would have done for loads of other patients. And in a letter, you've described it. So I'm not saying yet, I don't want to turn this into like a negative conversation, but I think it's just gone the way we've been chatting about looking after yourself if you're a therapist, and just identifying when you think you feel comfortable, and then the different types of communication that happen, and identifying those, I suppose, early, and what you're offering, and then, how much that takes a toll on you. Do you know what I mean?
Yeah, for sure. And I think that I'd say probably I'd probably just argue that last point, as I think I'd probably see it as a positive, in the sense that if there's any physios listening to this, there's no shame. You're all going to get a complaint. You're all going to get someone moan about you. It is normal. Just if it happens, chill out. If you've got a decent manager and someone in leadership that is half decent, the first thing that they'll do is probably have your back, support you. get your perspective and give you scope to develop and learn from it. So if you are somewhere where they're actually on your back before even listening to you, then leave. And just, that's normal, isn't it? Well, don't
Yeah,
leave.
yeah,
Don't
no,
just like leave. If you've got a mortgage, maybe just wait and then find another job. But
good. That's financial advice
all
provided
these
by
people
Memhet
messaging me going, Memhet, thanks for the life. It's great. I feel well supported. I
Get a job.
now live in a shoebox. I'm under a bridge.
Thanks for that. Yeah, really, really thanks. Just to kind of maybe shift a little bit towards your specialty, can't have the hip physio on without talking about hips. What do you think? Like, I'm sure you have a load of them because you're obviously really active on social media and really create some great stuff. When it comes into like communication around hips, right? If we just kind of go in on what would be the top, that wrecks your head around communication in hips, either whether it's diagnosis, whether it's what people say about hips, whether that's a therapist, GPs, patients themselves. Have you any kind of things that jump out that you kind of go, right, these are important things that people should know around communication and hips?
Yeah, look, I think the thing is, look, I only know what I know, right, which is hips. But also, I think when it comes to hips, everything is inherently over-dominated by labels, pathology, diagnosis, structure. And the annoying thing is, and this is the thing that pisses me off, right? Sometimes it is that. Actually, to be fair, it is that. But like, because of that, people take it and run with it. I'll give you a good example, right? Which is, so I've recently started to try and do more long form content for patients because it's just something I thought, like, I need somewhere to direct people and I want physios to have somewhere to direct people. So I started doing stuff that's a little bit longer. Now, when I'm doing that, then I'm thinking, right, how can more people see this? And I did something for glute tendinopathy, like GTPS. I'm thinking, I'm having to purposefully package this in a way that someone's going to go and search for bursitis because I know that's what they're going to go and look for. So I'm having to think, like, how can I do it? I don't want to, it's not like clickbait, but like you have to market it in a way. So like I get those people so they can see the right stuff, but it's unfortunately like that's what's rife. Like this, you go on any platform and it's like, I had one on Sunday. I posted something and I was looking at these, like, so when I'm on YouTube, like you can look at like other things in that category to see like, like how to like put the title of it. I was looking for it thinking, fuck's sake, like these people have like got like millions and millions of views and the title is like, fix your hip pain in 30 minutes. I'm thinking, are you mad? Like what? Like if I could do it in like 30 days, like in 30 sessions or whatever, like, do you know what I mean? Like, maybe not 30 sessions, but I think like, how is it, like, how are they getting away with this stuff? And that's what winds me up. But like, there's only so much. Like I've got to a point now, I think I can't just get pissed off of it. Like I'd rather just like, I focus on my own thing, do my own thing. Whoever sees it, hopefully sees it. And then it will just kind of continue to grow from there. But that's the thing. It's always like, loosen this up, the mobility thing. Mate, the mobility thing is the thing that really like, because the thing is, right? So, mate, you've opened a can of worms.
I knew. I thought I didn't want to start with this in case.
Right. But, like, the thing, like, so don't like ultimately on social media, like there's going to be a significant amount of people that are from the US, right? And in the US, the healthcare is different, and there are people that do different things in comparison to like just in the UK, right? And like this mobility thing when it comes to hips is so linear in that this is stiff, we loosen it up, this is loose, it feels better. For some people, yeah, that's fine. For certain hip conditions, it's like the antithesis of what you want to be focusing on. But like, that's not sexy, what I just said. Like, what is sexy is like, that's the problem. This is the quick cause, and this is the outcome. But people have it as their job. And then if you've like got that in a country like the US, where don't get me wrong, for some people it is outstandingly successful, but also for others it's not. But like that's what you tend to see. You tend to see like all these, it's a quick fix. For my patients that I see, annoyingly, what I get worried about is the individual who's seen 4 people, right? The individual who's then seen that post, and the individual who's done it and thought, why am I not getting any better? And then actually the reason for that is because pain is quite complicated. It's not just because your hip range of movement is diminished by 5 degrees in internal rotation. Like, it ain't that simple. And that's where my main frustrations come.
Yeah, like if you look at it, right, it's the ethical, what do you want to call it? Ethical kind of marketing where it's a catch-all. Fix your hip in 30 minutes, right? Do these exercises and you will get better. If you have 1 million people looking at that, which will be all the people who have hip pain from I've just got hip pain to I've had 20 years of hip pain, they'll all click on that because everyone wants that. As we just said, that brilliant. That sounds exactly what I want. You click on it, regardless. You do the thing. At the end of the day, they have the 1 million clicks now, so they can continue to generate whatever finance, money, whatever. So that will continue to live. And then 20% or 5%, or it doesn't matter, of a lot of people will get better from that, and then swear to God that is the best thing ever, and fill up the comments between this was amazing, I am now doing this, and then the others, this was terrible, it made my hip worse. It does not matter, because that in itself keeps this kind of slight, what I would call nearly like a social cancer going on, that everything is fixed by this thing. So it's really difficult to kill that. It's so difficult to kill that because if you're coming from the ethical point of view, no one really cares about that. And it was the same thing that Ben said about, we're effectively talking about communication here. It's the same thing that's happening in politics as well, isn't it? The communication on it, when you put it out, you're not going to write something on there that you can't, doesn't fit with your values. It's going to kill you, and you're going to get killed. So you can't do it. But other people don't mind that, and they might be living in ignorance about. They live in their own silo that says that's how you treat hip pain, or they just see people with that type of hip pain. And what we're dealing with, Ben was saying, like, he tried to make communication, posts for years now, and he says it just does not get the same traction as biomechanics. Like, no way. He says people, in his words, people lose their shit over biomechanics, whether it's actually really good or really bad. It doesn't matter. It'll still get all the clicks, and it will still keep that going. And I suppose, without feeling depressed about this, because again, you're doing a great job, you've been very successful in what you're doing, promoting this, and that's easily seen through your social media. But I suppose what you have to kind of do when you've got anything that's difficult to push against, you kind of have to create your own community of people who start to look at that. And hopefully more and more people, when they're actually dealing with real life people, therapists, will see that you can't just treat like this. And then it'll hopefully get into the ether. You know what I mean? You'll just grow. We can't change everyone. We just have to change small amounts. And then, over the next 10 or 15 years, people start to realize that type of approach doesn't work. Do you know what I mean?
Yeah, I know. And I agree with Ben. And I think, the thing is, the reason why the communication stuff doesn't sell, and the reason why the biomechanics does sell, is because you can't see communication and you can't see the skills of communication, right? You're not going to have, like, what are you going to do? Post a video of someone, like, two people standing next to each other just like talking. Like, that's not going to have the same amount of interest as someone putting up a picture of them doing some random stretch and then saying, oh, you know what? This is another thing that pisses me off. So, like, there's posts, right? And you'll see loads of stuff like this where it's like someone that is not a healthcare practitioner posting something about someone is standing there and they're like, look, their spine they've got scoliosis, and then one hip is higher. And because of that, their femur is rotated. And when their femur rotates, they've got a valgus at the knee. And because of that, they've got a pronated foot. You think like as if they're not looking like a baby giraffe if they're walking around like that. Like, I'm sure they're fine, but then when you have that, then you've got, this is the fix. Stretch this, strengthen that. It will pull this back into place. That's why that stuff sells, because someone somewhere. I'm going off on another tangent, but look, there's even accounts, right? That you could even half make sense from that stuff. There's other stuff on there that will be like, your psoas has stored your trauma. Emotional trauma for when you fell off your bike when you were 7. Like, there's so much stuff that doesn't even make sense that gets more traction than the communication stuff Ben was talking about.
But you know what's, I get it, and which is I'm hoping through these conversations that we start to unravel this a little bit and kind of come up with hopefully strategies, or you get people out there hopefully who do listen and then start to think how they can change their practice around this, or certainly develop it or research it or whatever it might be. But what's really interesting, which I get, so my course is Unraveling Strength and Conditioning for Physios, or therapists, sorry. And so people come on that, and big thing will be, right, without doubt, is how many reps and sets do I give? How many rest periods do I give? How many reps and sets do I give for this exercise? You know, without doubt, that's probably the most common thing that people are on or worried about to start with, right? Yeah, all of them will agree that communication is the most important thing, right? I very rarely, because we have a section where we talk about that, and everyone says all about how important that is, and if without that, you're not gonna have a good rapport with the patient, and therefore a successful relationship. But they're asking about dose, and what's interesting about dose is, for me, when I try and teach it, is like going, it depends. Like, if you've never lifted weights before, Mem, right, and when you do lift weights for the first time, it's weird. If you've lifted weights anyway, it's not that weird. But if you've never done it before, and you were trying to lift, like, say, something like 5 RM, so 5 heavy lifts, like, if you do that, it's a weird experience. It's really difficult. Like, first rep is business time. There's no getting away from it. It's fucking heavy, and you're like, oh my God, you have to have a word with yourself. So it's very rarely you're going to get, and it's not like you're going to get newbies doing 5 RMs. But what I'm trying to say to these physios coming on, or therapists coming on, going, how many reps are they going? It's a communication style. You have to kind of find their relationship with the reps and sets before you start applying the science of weightlifting or strength training. They just need to. So I'll say to some, they go, well, how do you know how many reps you're going to give them? Well, I'm just going to ask them. I'll say to them, how many reps do you think you'd want to do of this? And then I'll say, right, well, then I'll just apply the science to that. Well, look, the effort probably needs to be high. It needs to be probably around 8 out of 10 when you get to that 12 rep or 6 rep, because the research is so very dependent on a number of variables when it comes to strength training. So the whole point of what I'm trying to say is, when you're dosing somebody, most of the time they need to trust you, and you need to be able to communicate with them so that they can actually come up with their own dosage. And then that might be like whether they can only fit it in twice a week. And whether they can fit it in twice a week comes through a communication strategy of, when are we going to do this? What do you feel like at that time of day? Why would you do it at that time of day? Have you actually got the time of day? Because patients will say all sorts of stuff for when they can or when they can't do stuff. So it all comes back to, if you don't communicate that across, it don't matter how many reps and sets you give people. Do you know what I mean? Which is, so I think just these messages over and over again, like whether we could have the same thing with a shoulder specialist or a spinal specialist, we're still going to come across the same issues, aren't we? Whatever joint you're talking about.
Yeah, no, I agree completely. And it all of this stuff feeds into like outcomes, mate. Ultimately, like everything that you've just said there literally is like the fundamental of, well, if you don't communicate, maybe they don't do it well. Maybe they don't adhere to the plan. Maybe they don't get the outcomes that they want. It all starts from this. That's why it is so important that people just get the fact that this is a real important thing that they need to just get good at. That's one of the things that I get asked. I know we've got
we got a few minutes.
Just the last point. So one of the things that often I get asked when I talk to junior type physios is, they're like, oh, like, how did you do it? What did you do? Rotations, this, that, or like, how do I get into this, whatever? And I'm like, look, I can only talk from my perspective. Like, and I know how I got to where I am, and I know the most valuable thing for me that's made me as good as I am now, and like what I value for my skill set, is just getting in front of different people, different cultures, different environments, and different work setups. That's where I've got my not my hip skill. Like, that's secondary, because I'm all right at other stuff. Like, it's not just hips. I'm all right at other stuff, like, as well. But like, what's helped me get to where I am is all of that. So go into that job for 6 months where you think, it's going to be a ball ache. Like, the patients are going to be difficult. It's not an affluent area. It's a socioeconomically deprived. I'm going to need a translator. Like, that's where you earn your stripes. I remember, like, I had gone to my first. This is like what stemmed that, because I remember one of my first jobs was at a semi-professional football club. Mate, I honestly fucking knew nothing at all. Like, I had no idea what I was doing. I didn't know anything. Like, I just knew where the joints were pretty much at that point. I didn't know much else. And I was in a scenario where the head physio, this is a semi-pros, like two-ball football team, but the head physio was just like about to retire. I was doing way more than I probably should have at the time. And I was in an environment where I was having to like communicate with like coaches and managers and the players, and like players who wanted to play, players who didn't want to play. And I was thinking like, how am I having these conversations? And at that point, the thing is with me, I'm like, throw me in at the deep end. I don't care. If I don't know, I'll figure it out and I'll be good at it. Like, but at that time I was like, right, if I've done that and I've been able to take that away from it, and clinically, probably still I was pretty crap because I was literally just qualified. So you're fine, all right. And I try to use that in other jobs. If I was in a job where I was like having to learn or do stuff, I've never done it before, I was like, fine, I'll use that as an opportunity to like learn all these things. And that's where you get those communication skills from, like from being like, you're not, there's no point just being like in an environment where it's just like all your mates and the same kind of people, and you're not going to like have to develop it. Like you need those difficult conversations, challenging conversations, the ones where you like other people would be like, oh God, that I really don't want to call that patient. I know they're going to have a go at me. I thrive. I love them. I love those ones. You know, when you think like they are going to have a go at me, they're going to hate me. Like that's the one where I'm like, right, I'm gonna make that not happen. Like I'm gonna get them on my side. Like that's what I love. Like I thrive. This is another real quick point. Sorry, like because I need to go. I need to get the kids.
That's good. Yeah.
This is a situation that I spoke to someone about because it wasn't. I was going to work. This is. I don't want to bore you with it, but I was driving into the GP clinic. There was a car blocking the staff entrance, a big camper van, and I was trying to get around it. And the guy was screwing. I don't know why. He was just in a bad mood. He was like annoyed because he thought I was trying to like cut him up. I'm like, you're just blocking the staff entrance. Anyway, as I was going forward, he was going forwards. He wasn't getting out of the way. He was getting in the way, and I could see he was getting annoyed with me. But like I thought, let me pull up next to him so I could just say, "Don't worry, I'm just going to go in front of you." Anyway. As I did that, he opened his window down, put his arm out to like wave me like aggressively. And as he did that, he knocked his visor off his window, whatever it was. As he did that, I drove over it, like, and I smashed it. I grabbed it, and I was like, it couldn't have been worse timing. It was like comedy sketch. And I was like, fuck. And then he got out of his car. I got out of my car, and before I even got out of my car, I was like, go back. And as I'm going back, it's like crack. And he's like, oh, you've made that fucking worse now. And I was like, in my head, I knew it cost like probably £5 from Halfords. So I was like, oh mate, I'm so sorry. I'm really, really sorry. Let me know how much it is. Please let me replay it. Like I work here. I was just trying to get in the car park. I'm really sorry. And as I was talking to him, like he started to get a bit less irate just because of the way I was like trying to pacify that conversation. And then he got back in his van. I was like, mate, look, I'm really sorry. I gave a shit, right? I genuinely gave a shit. That's what made that conversation a lot easier. And I was like, I'm really sorry. Look, just let me know what it is. I'll transfer you money, whatever. It's like, no, don't worry about it. It's fine. Pacified, but he was still a bit pissed off. I was going there for a meeting. I just bought coffee and cookie for someone, like which sounds like fucking childish, I know, but like, I bought like the guy I was doing one-to-one with a biscuit because I'm just like that. I'm like that, right? So I bought him a biscuit. Anyway, I felt bad for this guy, so I kept my car where it was and I took the cookie around to him. And I said to him, look, I'm really, really sorry. It doesn't mean much. I know it's a bit random. I just bought this for a colleague. Like, please take it as a gesture. Like, I'm really sorry. And he was buzzing. And I was like, in any other situation, that could have gone fucking tits up. So the moral of the story is just always keep cookies in your car.
Man, listen, it was weird. Just before you went on to that last stuff, that gold stuff really was what I wanted to speak with Ben last night. We spoke off air exactly about how you develop your communication style. And I suppose what I take from all of that is that exactly putting yourself, not only about putting yourself in front of like, going to observe other therapists, not only observing from their physical or their medical skills, but actually, like you just said there, situations where you just think, this is going to be hard. Like these are difficult ones. I was on my respiratory ITU placement, and I had to develop a communication booklet because it was East London, 19 different languages. You can get benefits, and I suppose just to sum up what you said is you can get benefits from every kind of somewhat what you think is a shit situation. And actually, I know for a fact working in East London, although it was really hard at times, language barriers and stuff, exactly like you said, I'm like, now when I came to Cornwall, it was like, this is a piece of piss. People understand. I don't have to go through an interpreter, and you were so much more aware of it, So listen, that was really good, and I love that story. That's a great way to finish it. And
I appreciate you having me on, and hopefully someone listens to this.
Yeah, maybe just me, maybe just back
while you're editing it. Yeah,
yeah, that's it.
I appreciate you having me on. I better go because I'm on the school run today, so I better not be late. But yeah, thanks, and anyone that's listened, thank you.
Yeah, same as.
Thanks for listening to TCUP. If you liked it, tell all your friends. If you didn't, well, maybe you'll like the next one. Go to procareeducation.com or Procare Education on Instagram for more information on courses and the Bamboo Project. And remember, always be sound and not a dickhead.